I don't think anybody knows the answer to that question right now. The healthcare reform is a very complicated thing, of course, and as it rolls out in the next 3 to 5 and 10 years, the implications on the entire healthcare system aren't entirely clear. The cost of emergency medicine is a very complicated thing, too. For an emergency department to function, you have to have a large amount of resources that are fixed in place, and they have to be there 24/7, 365. You can't say, we'll wait to have all these things in place, CT scanner and the laboratory testing and all the nurses and the skill sets of the doctors and the nurses and the support staff. You can't say we'll have that when we need it. You have to have it in place all the time. So that really brings the cost of care up. So no one really knows. One of the hopes, of course, is that we'll have more insured patients under the healthcare reform. However, our cost to deliver care and the payments that we are given through Medicaid and Medicare, particularly Medicaid, which will increase in size in the healthcare reform, those payments through Medicaid and Medicare really don't even cover the cost of what it is for us to deliver care in emergency medicine right now. So it's really a complicated bit. I don't think anybody knows the answer. We'll have to be patient and just see how it all works out towards the cost of emergency care and the resources that we have moving forward. Emergency department volumes are very sporadic. I like to use the term surge. Surges of patient volumes are very sporadic, and there's also a predictable side to them. We know on Mondays and Sundays, particularly Mondays, we're going to have a really high volume day every Monday. Why? Well, nobody's really sure. That's just an acknowledgement. We know that's the way it is across the country, that Mondays are heavy. On the other hand, we may have a real surge on Thursday morning or Friday afternoon or in the middle of the week on Saturday. And we can't predict those surges and that sporadic kind of demand that we have in our services and for the services that we provide. For us, it's challenging because it's a very high-cost environment, and we always have to have that in place 24 hours, 7 days a week, 365 days a year. So we can't back away from those services that are essential to the possibilities of what's out there in the patients that might be coming into the emergency department. At the same time, though, we also have a financial responsibility that we can't staff it to the point where we're going to staff to the possibilities of everything that could happen or the worst day that we had in the last month. We have to find that middle ground, while at the same time having flexibility that if things are really come after us with a big surge, if we have a high surge of acuity or patient volumes, that we can rise to meet that challenge. So we have to develop financial models and staffing models that are flexible to allow us to surge up, but at the same time we have to invest and sustain investments that keep the minimum expectations that our patients deserve and that the system requires of us. So it's a very challenging process of trying to find that middle ground and also having plans in place and flexibility for the surge of those sporadic moments in acuity and volume for our patients.